Hello everyone, welcome to the United Talk updates. Let's talk about injury in team, Lisandro Martinez. On the 2nd of February 2025, in a Premier League home game versus Crystal Palace, Martinez was substituted off around the 82nd minute after suffering a knee injury in a challenge involving Ismaila Sarr. He was carried off on a stretcher. On the 6th of February 2025, Manchester United officially confirmed that Martinez suffered an injury to his cruciate ligament, ACL, and that ongoing assessments would determine the treatment plan and timetable. The club stated that Martinez will be supported every step of the way in his recovery. The injury was described by manager Ruben Amorim, then recently appointed, as a serious situation. Severity and expected recovery media reports have suggested that Martinez may be out for the remainder of the season, with some expectations of a 6 to 8 month recovery window, typical of ACL tears. Given that he already had knee ligament issues, MCL, in his history, the rehabilitation may be more complex. Some commentators note that he will miss until next season, depending on how the recovery process goes. Implications for his playing style and recovery risks. ACL injuries are among the most serious for a footballer, especially for defenders who rely on cutting, turning, pivoting, jumping, and physical duels. Rehabilitation typically involves phases: initial immobilization and swelling control, then gradual range of motion and strength restoration, neuromuscular training, proprioception, and then progressive sporting load. There is always a risk of complications: graft failure, if surgery is required, residual instability, loss of strength or proprioception, secondary injuries, meniscus, cartilage, or compensatory injuries. Given Martinez's prior knee ligament history, the risk of setbacks may be higher, and the medical staff will likely adopt a cautious approach to reintegration into full training and competitive matches. Team impact. His absence is a significant blow for Manchester United's defence, especially in Ruben Amorim's preferred system, often a back three where Martinez was expected to play on the left side. Outlook and monitoring. The precise timeline depends on scanning, MRI results, surgical decisions, if needed, and the absence of complications. Clubs often do regular MRI follow-ups, strength testing, biomechanical assessments, and performance metrics, e.g. isokinetic strength, hop tests, before clearing players for full return. Martinez's return might first be via limited training, controlled minutes, e.g. substitution or lower stakes matches, before full load. The club and media will likely update periodically. The cautious assumption is returning to full competitive play around 6 to 9 months, i.e. late 2025 or early 2026 if recovery proceeds optimally. Noussair Mazraoui. In September 2025, Ruben Amorim confirmed that Mazraoui was out injured and would not be available until after the upcoming international break. The club did not publicly indicate a new specific injury, e.g. muscle tendon at that time, leading to speculation that his prior cardiac issue or a fitness recurrence might be relevant. Thus, Mazraoui's situation is complex, part medical monitoring, part fitness management. Risks and considerations. With cardiac procedural issues, the priority is ensuring that any return to high-intensity exertion does not provoke arrhythmias or cardiovascular strain. The least risk possible is typically prioritized, so clubs often delay return until both medical clearance and confidence in conditioning are secured. Because the public reports have not disclosed further cardiac complications, one hopes his recovery progressed, but any relapse or new injury could complicate. The uncertainty regarding timing of his return means the coaching staff may have reduced flexibility in rotation or rest periods. Amad Diallo, Traoré. Amad Diallo, full name Amad Diallo Traoré, is an Ivorian winger-attacker for Manchester United. His injury record is less extensive than the defenders above, but he has had a significant recent setback. Ankle ligament injury, incident and timing. In mid-February 2025, Diallo sustained an ankle ligament injury during training prior to a match versus Tottenham. Ruben Amorim described that Diallo did a tackle, his foot stuck in the grass, causing the injury. In his social media post, Diallo said he would be out for some time. After that, Amorim stated publicly that Diallo was out for sure until the end of the season. Current status and outlook. As of the latest public reports, Diallo is still on the sidelines. Some media suggest he is expected to miss several weeks at least, though the earlier season-ending classification indicates caution. The club and medical staff will likely monitor his progress closely. If he returns, it would possibly be in limited minutes initially. Thanks for watching.